Hello, I'm Dion from Forward Carers, and we're an award-winning social enterprise and community interest company committed to creating carer-friendly communities. Carers are amazing people who care for a family member, friend or neighbour who couldn't manage without them. The caring role can be incredibly demanding and also rewarding, but without some support, some carers can struggle. So we care for carers so they can continue to support their loved ones. We achieve this by leading a network of over 20 non-for-profit delivery partners based in diverse communities, providing a wide range of support and services direct to local carers. Now, when the pandemic struck and we went into lockdown, we knew that carers would need us more than ever. Carers couldn't just stop, their loved ones relied upon them, so we didn't stop either. Across our delivery network, we made over 6,600 safe and well calls to carers via our telephone advice line, online, and even in some cases, doorstep visits. More than 2,300 carers joined our online groups. We registered 2,600 new carers and distributed over 400,000 in financial support. Despite the tremendous challenges, we were inspired by the incredible energy and resilience of carers. Here's more about our story of 2020.
It's been very tough, scary for the carers, especially having to shield for the majority of 2020 due to being clinically vulnerable and identified by GP and the NHS. I think this brought on a lot of challenges, increasing challenges with mental health, with social impact and the financial impact. Caring kind of became much harder. Losing their existing kind of physical and practical support networks that they're so used to, family and friends coming over to help out.
Carers couldn't come to, for example, Carer Zoom at noon, leave that meeting and then go to a mindfulness or a yoga or any other carers group or training session. And it's just, it's easier.
The investment from Forward Carers has been fantastic because it's allowed us to respond and prioritise more resources for carers and those who have been vulnerable. And a lot of that was really done, the emphasis is what Samira was saying. We organised Zoom meetings. We even established a WhatsApp group chat and made sure that those that are vulnerable had access to essential items such as food. Families that were low income had access to baby items. With the face-to-face, we found it was a perfect opportunity for wellbeing checks and look at if there were any issues around safeguarding as well, especially where children were involved.
We launched a carers group, Carer Zoom at noon. We also started a facilitator forum, so any of the partners or other organisations, GP practices, or volunteers that run a group.
Forward Carers helped us purchase laptops, so all the advisors had a laptop.
As part of this partnership, and we're quite happy and obviously appreciate the support and the investment from yourselves to firstly recognise that there was a need and a demand for this service and this project, and secondly ensuring that our carers, who are predominantly from the BAME communities, had access to a whole range of good quality carer related services.
I think there was a bit of kind of lobbying and trying to promote, which Forward Carers have done fantastically, and I think the carers card as well, that added to that sense of identity for carers, that they had a card that they could show at supermarkets and kind of say, I've got someone at home, or I've got someone I've had to bring them with me. There was that emotional impact on, and a lot of our advisors are carers, so there was that impact as well, and sending people home to work on their, in isolation. There's an awful lot you need to put in place in terms of coordinating that approach. It's down to resilience of people, that sending your whole team home of about 15 people could have been a complete disaster.
The staff have been amazing. Samira, the wider team, very resilient. we've had to adapt quite quickly. We focused on the needs and the challenges faced by our community and our carers, as well as trying to balance how best to protect everybody, including staff and volunteers. So everybody's worked amazingly. They've managed to cope and change with the demand. I'm very proud of everybody involved in this partnership arrangement as well and delivery.